Lisinopril, an ACE inhibitor commonly prescribed to treat high blood pressure and heart failure, is generally well tolerated. However, like all medications, it may cause side effects. Most side effects are mild and temporary, resolving as the body adjusts. Still, some may be more serious and require prompt medical attention. Understanding the full range of potential lisinopril side effects allows you to manage them effectively and know when to seek help. Here are 14 possible side effects of lisinopril you should be aware of. 1. Dizziness. Dizziness is one of the most frequently reported lisinopril side effects. It typically occurs shortly after beginning treatment or following a dose increase. While this symptom often improves as your body adapts to the medication, it can pose a risk, particularly for older adults, due to the potential for falls. If dizziness occurs, it's important to sit or lie down until it resolves. Rise slowly when moving from a seated or lying position, and consider using support if needed. Staying well hydrated may also reduce the likelihood of dizziness. Persistent or worsening dizziness should be reported to your healthcare provider. In some cases, it may indicate that your blood pressure is too low, which can require medical evaluation. 2. Low blood pressure and fatigue. Lisinopril's intended effect is to lower blood pressure, but in some individuals, it may lower it too much, a condition known as hypotension. This can cause symptoms such as fatigue, weakness, and even fainting. However, mild fatigue may simply be a sign that the medication is beginning to work. To minimize this risk, providers often initiate treatment with a low dose, gradually increasing it as needed. This approach helps your body adjust and maintains your blood pressure within a safe range. If you consistently experience symptoms of low blood pressure, such as lightheadedness, extreme fatigue, or fainting, contact your healthcare provider. Adjustments to your dosage or a different medication may be necessary. 3. Dry cough. A persistent dry cough is one of the hallmark side effects of lisinopril. Patients often describe it as a tickling or irritating sensation in the throat. This occurs because lisinopril can lead to a buildup of bradykinin, a protein that may cause the airways to constrict, triggering a cough. This side effect may develop within weeks or months of starting the medication, but it can occur at any time. For some, the cough is mild and tolerable. For others, it may be persistent and disruptive. If you notice a new, unexplained cough after beginning lisinopril, consult your provider. They may recommend switching to an angiotensin II receptor blocker, ARB, such as losartan, which provides similar blood pressure benefits with a lower risk of cough. For diarrhea. Though less common, diarrhea is another potential lisinopril side effect. While lisinopril can be taken with or without food, taking it with meals may help minimize gastrointestinal discomfort. Additionally, avoiding spicy or greasy foods can reduce the severity of this symptom. If you develop diarrhea, staying hydrated is critical. However, persistent or severe diarrhea is not typical with lisinopril and should be discussed with your healthcare provider to determine whether lisinopril or another issue may be the cause. Headaches are a relatively common lisinopril side effect, particularly when first starting the medication or following a dose adjustment. They may occur as a result of the blood pressure-lowering effects of lisinopril. In most cases, these headaches are temporary and improve as your body adapts. Staying hydrated and getting adequate rest can help manage the discomfort. If necessary, over-the-counter pain relievers such as acetaminophen, Tylenol, may be used to ease symptoms. However, it is important to speak with your healthcare provider before using non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, Advil, Motrin. These medications may interact with lisinopril by increasing the risk of kidney damage and reducing the medication's effectiveness in controlling blood pressure. Report persistent or worsening headaches to your prescriber, as they may require further evaluation. 6. Blurry vision. Although rare, blurry vision has been reported as one of the possible lisinopril side effects. This may occur shortly after starting treatment or increasing your dose. In some cases, it may reflect a drop in blood pressure as the medication begins to take effect. If you experience blurry vision, it is best to avoid driving or engaging in activities that require clear vision and concentration. For many people, this symptom is short-lived and resolves without intervention. Blurry vision that persists or occurs alongside fatigue, fainting, or dizziness may be a sign that your blood pressure is too low. Contact your prescriber promptly, as this could indicate the need for a dose adjustment. 7. Elevated creatinine levels. Lisinopril can cause an increase in creatinine levels, a marker used to assess kidney function. While mild increases are common and often reversible, significantly elevated creatinine may indicate that the kidneys are not processing waste efficiently, potentially placing strain on kidney function. This lisinopril side effect does not typically cause noticeable symptoms. For that reason, your provider may order routine blood tests to monitor kidney function, particularly during the early stages of treatment or after dosage changes. If your creatinine levels rise too much or fail to return to normal, your provider may lower your dose or consider an alternative medication. 8. High potassium levels. Lisinopril may contribute to elevated potassium levels in the blood, a condition known as hyperkalemia. Most cases are mild, but in rare instances, potassium levels can become dangerously high, leading to potentially serious health issues, including abnormal heart rhythms. Certain individuals are at greater risk for this side effect, especially those with diabetes, kidney disease, or those taking other medications that increase potassium, such as spironolactone, aldactone. Because high potassium often presents without symptoms, regular blood tests are essential. These tests allow your provider to monitor your potassium level and make adjustments to your treatment plan if necessary. In some cases, reducing the dose or switching to a different medication may be required. 9. Chest pain. Chest pain is a potentially serious lisinopril side effect and should never be ignored. While chest discomfort can result from minor causes such as indigestion or muscle strain, it may also signal more critical conditions, including cardiovascular events. If you experience chest pain while taking lisinopril, notify your healthcare provider immediately. They can help determine whether the symptom is medication-related or due to an underlying health issue. However, if the chest pain is severe, worsens with physical activity, radiates to other parts of the body, or is accompanied by nausea, vomiting, or shortness of breath, it could be a sign of a heart attack. In such cases, call emergency services or go to the nearest emergency room without delay. 10. Swelling of the face, lips, or tongue, angioedema. Angioedema is one of the most serious and potentially life-threatening side effects of lisinopril. This condition involves sudden swelling of the face, lips, tongue, or throat and may obstruct the airway, leading to difficulty breathing. Unlike a typical allergic reaction, angioedema associated with lisinopril is thought to result from a buildup of bradykinin, a protein that can lead to fluid leakage and tissue swelling. Notably, this reaction can occur at any point during treatment, even in patients who have taken lisinopril for years without issues. Certain populations are at higher risk of developing angioedema while taking lisinopril, including Black individuals of African descent, women, older adults, people who smoke, individuals taking NSAIDs such as aspirin or ibuprofen, those with a personal or family history of angioedema, especially hereditary or idiopathic types, should avoid taking lisinopril altogether. If you experience any facial swelling while on lisinopril, contact your prescriber immediately. Emergency care is necessary if the swelling is sudden, involves the tongue or throat, or causes trouble breathing. 11. Severe skin rash. Although uncommon, lisinopril has been linked to serious skin reactions, including hives, eczema-like rashes, and in rare cases, life-threatening conditions such as Stevens-Johnson syndrome. If you develop a skin rash while taking lisinopril, regardless of severity, contact your healthcare provider. Prompt medical attention is especially important if the rash is widespread or accompanied by fever, blistering, or other systemic symptoms. Early identification and management of this rare lisinopril side effect can prevent serious complications and may require discontinuation of the medication. 12. Liver damage. Liver injury is a rare but documented side effect of lisinopril, typically occurring within the first year of treatment, though it can develop at any time. In most cases, the condition is reversible once the medication is stopped. Symptoms of liver damage may include jaundice, yellowing of the skin or eyes, dark-colored urine, unexplained fatigue, upper abdominal pain. Patients with a history of liver disease should inform their provider before starting lisinopril. Your healthcare team may order routine liver function tests to monitor for potential complications. If you experience signs of liver dysfunction while taking lisinopril, report them promptly. Your provider may recommend discontinuing the medication or switching to a safer alternative. Birth defects. Lisinopril should not be used during pregnancy. Among the most serious lisinopril side effects, this medication carries an FDA-boxed warning due to its potential to cause harm to a developing fetus. Lisinopril can interfere with fetal kidney development and significantly reduce amniotic fluid levels, which are critical for protecting and supporting the baby's growth. These complications can lead to serious or even fatal outcomes. If you are pregnant, planning to become pregnant, or suspect that you might be pregnant while taking lisinopril, contact your healthcare provider immediately. Your prescriber will likely stop the medication and transition you to a safer alternative, such as methyldopa or labetalol, both of which are considered safer options for managing high blood pressure during pregnancy. 14. Allergic reactions. Though rare, allergic reactions to lisinopril can occur and should be taken seriously. While not classified in the same category as typical lisinopril side effects, allergic responses may include symptoms such as skin hives, itching, or more severe reactions like anaphylaxis. Anaphylaxis is a life-threatening condition that involves swelling of the throat, difficulty breathing, and a drop in blood pressure. Because it's not always possible to predict how severe an allergic reaction will become, any suspected reaction should be promptly reported to your healthcare provider. If symptoms appear severe, such as difficulty breathing, rapid swelling, or chest tightness, call emergency services immediately. Final thoughts. Lisinopril is a commonly prescribed medication that plays a vital role in managing high blood pressure and heart-related conditions. However, being informed about both the common and rare lisinopril side effects is essential for safe and effective treatment. While many side effects are manageable, others may require medical intervention. Always follow your prescriber's guidance, and never hesitate to report new or unusual symptoms. Routine follow-ups and lab monitoring can further reduce your risk and ensure the medication remains safe for you. Subscribe to HeInfo for trusted health insights. If you found this video helpful, be sure to subscribe to HeInfo, your go-to channel for reliable, doctor-reviewed health content. We break down medical topics so you can make confident decisions about your health. Don't forget to like, share, and leave a comment if you have questions about lisinopril or other medications. Your health deserves clarity, and that's what we're here to provide. Stay informed. Stay healthy.